It was important that we spend some time talking about alcohol in the body because alcohol is the drug that people are most commonly arrested for driving under the influence. There are other drugs that people also get arrested for driving under the influence. And I thought it would be important that we talk about a couple of those. Two that we're going to talk about, one is marijuana, and then the second group we're going to talk a little bit about prescription opioids. It's important to talk about marijuana because after alcohol, marijuana is the substance most commonly found in the blood of impaired drivers, fatally injured drivers, and motor vehicle crash victims. So it's obvious that people are out there driving under the influence of marijuana. Marijuana is a natural drug, and it comes from a plant called the cannabis sativa, and this plant produces leaves, flowers, and stems and seeds that all contain the major psychoactive chemical in marijuana, and that's delta-9 tetrahydrocannabinol, or THC. So THC is the chemical in marijuana that actually causes changes to take place in the brain when someone ingests marijuana. THC actually affects the parts of the brain that influence pleasure, memory, thinking, concentration, sensory and time perception, and coordinated movement. Users of marijuana do experience a sense of euphoria, but with that euphoria comes distorted perceptions, the impaired coordination, and difficulty with thinking and problem solving. Unlike alcohol, marijuana, interestingly enough, is fat soluble and not water soluble. Once in the bloodstream, it's stored in the body fat, and THC is slowly eliminated from the body. So to give you an idea of how long marijuana can actually stay in the bloodstream, THC that's absorbed from one marijuana cigarette can be detected in urine for about 1 week. And in a marijuana smoker who has been accumulating THC in the body by smoking more than once, THC may actually appear in the urine for as long as 1 month. Marijuana is addictive. There has been some debate about that, but long-term marijuana users who try to quit report withdrawal symptoms that include irritability, sleeplessness, decreased appetite, anxiety, and drug craving. So marijuana does produce tolerance and the characteristics that are similar with other drugs that produce addiction. Okay, another form of marijuana that's been available for some period of time now is a synthetic form of marijuana called spice. Marijuana, as I mentioned before, in its natural form as a plant is considered a natural drug. In other words, the active ingredients in marijuana that affect the brain are there just as part of the natural plant, the cannabis plant. Synthetic drugs are a little bit different. Synthetic drugs do not come from plants. They're actually manufactured in the laboratory. And a synthetic form of marijuana has been created. And so with the synthetic marijuana, a mixture of different herbal plants is used, and those plants are actually sprayed or seeded with synthetic marijuana, and they produce some of the same effects that marijuana produces that would come from the plant. Many states now have passed laws that have made it illegal to sell and use synthetic marijuana. So very important to understand that synthetic marijuana can also get you in trouble for driving under the influence. Another group of drugs that I would like to talk a little bit about are prescription opioids. As the word implies, these are prescription drugs. The way that you access these drugs is by receiving a prescription from a physician and then having that prescription filled by a licensed pharmacist. But interestingly enough, more than 12 million people reported using prescription painkillers non-medically in 2010. In other words, they had no prescription for these medications, and they were actually obtained illegally. So they were using them not for medical causes, but for the feelings that they cause or produce. Abuse of opioids alone or with alcohol or other drugs has serious consequence because these medications can depress the respiratory system and actually lead to death. Unintentional overdose involving prescription opioids have actually quadrupled since 1999 and now outnumber the number of unintentional overdoses from both heroin and cocaine. So abusing these drugs has very, very serious consequences because prescription opioid pain medications like Oxycontin and Vicodin have very similar effects to heroin. And they are synthetic versions of heroin. So that makes them very powerful central nervous system depressants, and they are very, very addictive. Normally they are prescribed for pain relief, anxiety, and sleep disorders. And if they're used properly, they can produce sedating or calming effects. But side effects can also include drowsiness, mental confusion, nausea, and again, as I mentioned, depending on the amount that's taken, can depress respiration and actually lead to death. These are two additional drug categories, marijuana and prescription opioids, that it's important that we understand a little bit about them and the seriousness of using them. I'd like to draw closure to Module 2, which focuses on drugs in the human body, with the topic of polydrug use. Polydrug use is the intentional use of more than one drug at the same time. The intent often is to intensify the effects of one drug or counter the effect of another drug. Polydrug use may also occur when a drug user's drug of choice is not available or is expensive at a particular time. So they may combine other drugs to try and get the same kinds of effects that they used to get from their drug of choice. So what happens in terms of polydrug combination? Well, there are three different things that can actually occur. One is the additive effect. Second is the synergistic effect. And the third is the antagonistic effect. So what happens in the additive effect? Well, this is the combined effect produced by the action of two or more drugs, and they're equal in the sum of their separate effects. So it's like a 1 plus 1. So one dose of this drug plus one dose of the other drug equals 2 doses. So their separate effects are actually the same. That's the additive effect. Another effect that can occur is two or more drugs that work in a similar fashion, and you combine them and you get a greater effect than you would have had if you used the drugs separately. So in this situation, instead of 1 plus 1 equals 2, you're now combining drugs that have similar effects, and they intensify the singular effect that you would have gotten from one of the drugs. So instead of an addition sign in there, you have to use a multiplication sign. So one of these drugs in addition or supplemented by another drug doesn't equal 2 doses. It may actually eat 3, 4, or 5, or 6 doses. So you're multiplying or intensifying the effect. And then the third effect is the antagonistic effect. And this is a drug interaction that produces a combined effect that is less than the intended effect of either one of the drugs. So when you add one drug plus the other drug, instead of getting an intensified or additive effect, you actually get a lesser effect where you don't feel the effects of the drug in the same manner that you would if you hadn't combined the two. And again, people combine drugs for different purposes. If they want to intensify the effect, they might combine alcohol with prescription opioids, like alcohol and Vicodin, for example. That would give, they both have similar central nervous system depressant effects, and that would give you a very intensified synergistic effect. Sometimes people don't like the effects of drugs, of a particular drug, or the way they feel after they've taken the drug. So, for example, they may have taken stimulants, and they no longer want to be stimulated. Now they would rather calm down, relax, and maybe sleep. And so what you do is you combine a depressant drug with a stimulant drug, and that gives you the antagonistic effect. What are some concerns about polydrug use? Well, when you're combining drugs, and again, sometimes these drugs are combined with alcohol also, but when you're combining these drugs, it's the liver that metabolizes these drugs like it does alcohol. So now you have multiple drugs on board, and you're really challenging the liver's ability to break down and remove these drugs from the bloodstream. So the drugs are actually going to be metabolized at a slower rate. This can result in drug effects that are prolonged and maybe sometimes even exaggerated. In the case of exaggeration, we'd be talking about the synergistic effect, where the effects of the two drugs intensify the effect that you would have gotten with a singular drug. By mixing drugs and combining drugs over time, there is an increased risk for producing liver damage. And one of the major concerns associated with polydrug use is because the drugs are not broken down at the rate that they normally would be broken down. Individual might be setting themselves up for a drug overdose. So there are very serious concerns combining drugs, either drugs that have similar action or opposite actions. I mentioned a little bit earlier about combining alcohol and caffeine. I wanted to just take a couple minutes and use this as an example, maybe to help you understand this idea of polydrug use. So an important concept here is that when you combine drugs, it doesn't mean that they eliminate each other. It doesn't mean that a depressant drug will remove a stimulant drug from your body. When you combine those drugs, you're either going to get an additive effect, a synergistic effect, or an antagonistic effect. It's not, these effects are not changing your blood level of these drugs, but what these effects are doing is changing how you feel and how the body responds to these drugs, and in particular the brain. So when we combine alcohol and caffeine, both of those drugs are still affecting the brain. The difference is your feelings and perceptions are altered. So when you combine drugs, and when you combine alcohol with caffeine, for example, you're going to have a different sensation or different feeling or different perception of how those drugs are affecting you than if you would have consumed alcohol alone. And You know, after a period of time of drinking alcohol, you can sort of anticipate how you feel while you're drinking alcohol. Same thing with caffeine. Over a period of time of use of caffeine, you have the sense of how caffeine makes you feel. Well, when you combine these two, both of them are still actively affecting your brain, but the way you perceive and feel under the effects of these drugs is different. So quite simply put, when you combine alcohol with caffeine, you're still getting intoxicated and impaired from the alcohol, but you may not feel as impaired because you've taken an antagonistic drug, caffeine. Now this is actually a dangerous combination because now you don't feel as impaired, and so an individual may be more likely to drink more because they don't feel impaired, and they may actually be more prone to accidents and injury because they don't have the same perception of being under the influence of alcohol. So in other words, they could literally be intoxicated and not really know it or perceive it. So combining drugs can actually be a very dangerous thing to do because it alters the effects of both of those drugs and how you feel under the influence of those drugs. Okay, that will wrap up our Drugs in the Human Body module, and we'll be ready to move on to module number 3.